It just seemed like I wasn't getting enough blood to my head. I was so dizzy all the time.
Oxygen wasn't getting places that it needed to be, and so my brain just wasn't working.
None of my family really wants to talk about it either, because it was traumatic for all of us.
Fatigue, chest pain, digestive problems, difficulty sleeping. Just a few of the symptoms experienced by people with long COVID. Yet these patients have at least one thing in common: an immune system sent haywire by the coronavirus. I've travelled across the US meeting people affected by long COVID and the experts trying to unravel exactly what causes it and how to treat it.
Because at the moment, we have a lot of questions, not that many answers.
That's right.
The impacts are profound. Harvard economist David Cutler puts the cost of long COVID at $3.7 trillion in the US alone, and the condition could impair 140 million people worldwide. Lisa is one of them. The 37-year-old neurologist and mother of two was infected with COVID-19 in November 2020.
I couldn't work my job as a physician. I couldn't really be a mom. I had to basically lock myself in my room, and my husband had to take over all the parenting duties. So it was a big change to go from defining yourself as a doctor and a mom to not having either of those define you anymore.
Lisa's symptoms improved after months of treatment. She says the ordeal has made her a better doctor and taught her a few lessons along the way.
Each moment you can really be like, oh my gosh, this is amazing. Oh, I get to spend time with my kids. It's been really rewarding to, apply what I've been through to my patients so that I can help them as best I can.
Like Lisa, Morgan's heart was racing months after getting COVID. It's due to a blood circulation disorder known as postural orthostatic tachycardia syndrome, or POTS. The 23-year-old Yale student also noticed her energy and concentration dwindling.
The sort of decline over the course of the semester was so gradual that I didn't realize the degree to which that was happening until I hit a point where I couldn't function. I noticed in the mornings that consistently my heart rate would be 120, 122 beats per minute while brushing my teeth. My battery, it doesn't really charge past 50% or 40%.
Doctors warned health officials of COVID's long-term effects back in 2020. Scientists are still studying what causes it to know how best to treat the condition. Akiko Iwasaki is a professor of immunobiology at Yale School of Medicine. She says one of the challenges finding answers stems from the diversity of patients.
We say everything is long COVID, but long COVID is likely multiple different diseases under the same umbrella. If the disease is caused by different things, the treatment should be different, diagnosis should be different, right? And if we bunch everything together, it's too complex. And so we can't even identify the right patients for right therapy.
Lisa and Morgan weren't hospitalised for COVID. Akiko says they represent the dominant group of long COVID sufferers, women aged 20 to 60 who had a mild or asymptomatic infection. But other patients suffer symptoms related to their critical illness. I met Kelly at her home in April.
Hi Kelly, Jason Gale.
Nice to meet you.
Thank you.
In early 2021, she spent 6 weeks in a drug-induced coma after getting COVID.
While I was under, I had the most horrifying nightmares, but I wasn't like all the way under, so reality was working its way into my dreams.
Ironically, much of Kelly's impairment relates to her treatment in the ICU. She now struggles with PTSD and post-intensive care syndrome.
There were times I remember in my head banging on what would be a wall. I have no idea. Get me out of here, get me out of here. Obviously no one's hearing me.
And the trauma extends to family members as well. Kelly's husband Jay was told it was time for the family to say goodbye, and her mother Brenda recalls preparing Kelly's obituary.
The emotions were roller coaster. And even now, even a year and a half later, it is very difficult to talk about. She's doing much better. She's alive. And we're so grateful for that because it could have gone the other way.
Back in April, Kelly had played down her symptoms. 5 months later, when I caught up with Kelly and her family, she described being tormented by her PTSD literally night and day.
It's actually been getting worse.
Yeah. With the PTSD, there's a lot of anxiety that happens. I'm 52, and I hopefully will live till, at least a few more years. I don't want to spend the rest of my life like this.
At least 250,000 Americans survived a bout of COVID severe enough to put them in the ICU. Research indicates the majority are suffering at least some effect 1 year later. While some long-haul patients recover over time, others don't, and there are no proven remedies for them. But dozens of trials slated for completion in the next year may yield clues. Results of a small observational study indicate intravenous immunoglobulin, or IVIG, might offer some promise. It's a recognised treatment for small fibre neuropathy, and it's the treatment Lisa received.
I'll get your stickers, okay? It took quite a while to figure out how I could tolerate it. I believe that's what helped me recover. It's hard to know what would have happened without it, of course.
So I'm at the Massachusetts General Hospital about to meet Dr. Anne-Louise Oaklander. She's a neurologist investigating small fibre neuropathy. It's something that she's finding is occurring commonly in long COVID patients, and I'm also going to be enrolling as a healthy volunteer in a clinical trial she's running.
Yeah, good to see you
Jason,
again.
thanks very much for coming in and helping with our study.
No problem, thank you. You're going to be doing the biopsy?
Indeed, and a neurologic exam on you. This is that little pinch. Have the forceps, Alice? Skin biopsies from the leg, which allows us to look directly at the small fibers and count them and see if there's evidence that some of those small fibers have become so damaged that they've gone missing from the skin. Tiny little piece.
COVID has left a trail of disease, disruption, and social and economic distress in its wake. We're learning much about its aftermath by analysing patient data. Ziad Al-Ali is the director of the Clinical Epidemiology Centre at the VA St. Louis healthcare system, where he's led multiple studies that have reported important early findings about long COVID.
We've done a remarkable job in developing vaccines in record time. We need to replicate, learn from that success, and replicate that success in the long COVID research arena. This is not one or two cases. These are millions of people in the US, many more around the world affected with long COVID.
We've only just begun to scratch the surface in understanding COVID's lasting effects. What's clear already is that the consequences of this viral disease will be vast and enduring unless scientists find ways to mitigate them.
Part of living with long COVID, I think, for me has been about coming to accept that I have limitations and learning to find my best options.
Be it IVIG or something else, I do think that we will figure out the solution, and there's millions of people suffering with it. So there's a lot of drive to figure it out.